Hello, and welcome to Group 1's presentation on sporadic amyotrophic lateral sclerosis, ALS. First, let's begin with the disease summary. General information. Sporadic amyotrophic lateral sclerosis, or sporadic ALS for short, is a fatal and incurable type of motor neuron disease that causes progressive degeneration of nerve cells in the spinal cord and brain. It is also known as one of the most devastating types of disorders that affect nerve and muscle function. Let's clear up some terminology so we can understand what's going on here. Sporadic. 90% of ALS cases are sporadic, meaning that the cause or causes of the disease are unknown and that anyone could develop it. But it is also significant to note that approximately 5 to 10% of cases are due to genetic mutations and are inherited from a family member. But we'll be covering the sporadic type. And motor neurons. They are a type of nerve cell that send messages around your body so you can move. Here, we have a picture depicting a general motor neuron and the connection between its neuromuscular junctions and muscular fibers, and a diagram of the location of the brain and the spinal cord on the body. Continuing with the general information, there are two kinds of motor neurons, upper and lower motor neurons. Upper motor neurons originate from the motor region of the cerebral cortex or from the brainstem and transmit nerve impulses from the brain to the synapses of lower motor neurons. Now, lower motor neurons are found in the brainstem and in the spinal cord and form synapses with the muscles to transmit nerve impulses received from the upper motor neurons to the effector muscles. Sporadic ALS kills both the upper and lower motor neurons through mode of apoptotic cell death that may occur by an abnormal programmed cell death, or PCD, mechanism, which is a controlled mechanism that eliminates specific cells under developmental or environmental stimuli, which for now is unknown, but there's much research being done about that. Here, we have an illustration depicting the location of upper motor neurons in the brain and the path they take through the brainstem to the spinal cord to the lower motor neurons, as well as the lower motor neurons' location in the spinal cord, shown with a cross-section of it, and how they transmit these signals to the muscles. Finally, for the general information section, let's discuss a connection to the types of nervous systems. So, what is a nervous system? A nervous system is the network of nerve cells and fibers that transmits nerve impulses between parts of the body. Now, there are two sections of the nervous system, the CNS and the PNS, which are the central nervous system and the peripheral nervous system. So the CNS consists of the brain and spinal cord, whereas the PNS constitutes the ganglion, which are a collection of neural bodies, and the cranial, spinal, and peripheral nerves, as well as the neuromuscular junctions. Neuromuscular junctions are the synapse between a motor neuron nerve terminal and its muscle fiber that are responsible for converting electrical impulses generated by the motor neuron into electrical activity in the muscle fibers. Let's use this information to create a general connection of the muscular system to the nerve system. This neurodegenerative disease gradually results in the loss of control over the muscles that enable us to walk, talk, chew, swallow, and breathe. The reason for and implications of this will be explained more in depth in the mechanism section. And here we have a diagram with a flow chart outlining the differences in location and function of the CNS and PNS. It is important to note here that the nervous system is composed of the CNS, which is the somatic nervous system, which is voluntary movements, sensory input, and motor output, which controls the skeletal muscles, as well as the PNS, which is the autonomic nervous system, in charge of involuntary movements and in internal processes. Now, this divides up further into the sympathetic, which is the fight or flight responses, and the parasympathetic nervous system, that is the digest and restoration of the body to a calm and composed state, as opposed to the fight or flight response of the sympathetic nervous system. Next, we'll discuss the history of the disease. So here's some historical background. ALS was identified in 1869 by French neurologist Jean-Martin Charcot at his clinical workhouse in Salpêtrière Hospital that housed about 5,000 patients, of whom more than half suffered from a form of a neurological disorder. This hospital was a former gunpowder warehouse, and it was refashioned into a prison, hospital, and asylum for prostitutes, the mentally ill, criminally insane, and the destitute. Charcot called this disease primary Amyotrophic lateral sclerosis, ALS, and correctly identified the dysfunction of anterior horn cells as the pathology underlying the clinical features. But ALS became more widely known internationally on June 2, 1941, when it ended the career of one of baseball's most beloved players, Lou Gehrig. For many years following, ALS was commonly known as Lou Gehrig's disease. Gehrig played with the New York Yankees for 17 years and received the moniker the Iron Horse due to his ability to play baseball despite suffering from a variety of injuries. Shortly after his diagnosis, he chose to retire from baseball. Here on the left, we have a picture of Jean-Martin Charcot, and on the right, we have Lou Gehrig. Now on to natural history. If left untreated, those with the disease may face the following: loss of mobility, seeing as voluntary movements of arms and legs become impossible, resulting in the inability to move around and do basic activities such as eating, drinking, and breathing. Pressure injuries or bed sores can also occur to areas of the skin that are under constant pressure from lying in bed or sitting in a wheelchair for long periods of time. They are also at risk of losing weight from loss of muscle mass, malnourishment, and muscle stiffness develops from spasticity, as well as drooling because of lower facial weakness. And movement of the diaphragm for breathing is also impaired, so without the help of a ventilator, death from respiratory failure may occur as well. Here we have an infographic outlining how some of the most debilitating symptoms of the disease, such as immobility and lack of nutrition, hydration, and malnutrition, are the risk factors for the bed sores and their most common locations, along with an illustration of an individual on a ventilator because they are unable to breathe on their own. Now let's cover the prevalence. The average incidence rate of ALS worldwide is about 1 in 50,000 people per year, which equates to about 5,760 to 6,400 new diagnoses per year. The average age of onset of the disease is about 60 years, with men at a slightly higher risk compared to women. This accompanies a male-to-female ratio of 1.5 to 1. ALS is reported to have higher incidence rates among Caucasians, 93%, and non-Hispanics compared to other ethnic groups. The prevalence of ALS is about 1 in 20,000 at any given time in Western countries, and this has remained relatively unchanged in recent years. Here we have two infographics detailing statistics on the prevalence of ALS. Specifically on the left, the infographic shows major increases in the percentage of increase of those with the disease from 2015 to 2040, especially in developing countries such as Libya and Iran. The infographic on the right references how someone is diagnosed with ALS every 90 seconds, the average age of diagnosis, and how men are at a higher risk of having the disease as well. And finally, for the disease summary section, the presentation of the disease. The presentation of the disease and the average percentage of patients who display them are as follows. Classic presentations of ALS include asymmetric weakness of extremities, 60 to 80%, bulbar symptoms, 20%, which are difficulty swallowing, weak jaw, and facial muscles, progressive loss of speech and the weakening of the tongue, respiratory muscle weakness, 1 to 3%, generalized weakness in limbs and bulbar muscles, 1 to 9%, axial onset with head drop or truncal extension weakness, muscle atrophy, fasciculations, which are involuntary spasms common to the eyelids and legs, and cramps. Although diagnostic criteria for ALS was revised in 2000, lack of a sensitive diagnostic test is a major obstacle to early diagnosis of these patients. Currently, there is no widely accepted diagnosis test for ALS. Neuroimaging and other lab tests are used to exclude other diseases, while electrodiagnostic tests are used to support the diagnosis. Here we have a diagram of the human body, including the internal organs and the locations of where some of the presentation of the disease occur, and those with sporadic ALS, including but not limited to cognitive impairment or decline, dysphagia, dysarthria, respiratory insufficiency, muscle cramps, spasticity, and muscle weakness and atrophy.
Possible causes. Research still has no definitive answer as to what causes sporadic ALS, which is the most common type. About 90% of ALS cases occur without family history, which is known as sporadic ALS. The remaining 10% of ALS cases are inherited through a mutated gene, which is also known as familial ALS. Most people who develop ALS are between the ages of 40 and 70, with an average of 55 at the time of diagnosis. Cases of the disease do occur in people in their 20s and 30s. ALS is 20% more common in men than women. However, with increasing age, the Incidence of ALS is equal between men and women. Genetic factors, oxidative stress, glutamatergic excitotoxicity, and damage to vital organs are all leading causes to muscle degeneration in ALS. Disease path. In stage 1, the muscles become softer and appear to be weaker, or sometimes become tight and spastic. Cramping and twitching are also common signs that ALS in its early stages. Patients who have been a target of ALS will experience fatigue and will have poor or very bad balance. In the second stage or the middle stage, the muscles of the affected areas will be paralyzed and other muscles will seem stiff as they were about to become paralyzed as well. ALS will cause contractures in unused muscles, stimulating a lot of pain. The joints will become rigid and deformation of joints will be visible, and the person will face a lot of difficulty in standing on their own. The late stage of ALS, all of the voluntary muscles, or at least 90% of them, will be paralyzed. Muscles in the lungs, which help in inhaling and exhaling, will be severely damaged. Mobility will be very restricted, speech will be disoriented, and eating and drinking through the mouth will become almost impossible and will have to be through another source. The last stage of ALS, the patient may pass away to the lack of oxygen and disability to use the lung muscles. Swelling of passageways while swallowing food can result in choking and may be fatal. Abnormalities can cause cardiac arrest and prove to be fatal. Disease's connection to the central nervous system and peripheral nervous system. Peripheral nervous system. These motor neurons transmit impulses from the spinal cord to the skeletal and smooth muscles, and so directly control all muscle movements. In the central nervous system, motor neurons are neuronal cells located in the central nervous system and connect to muscles, glands, and organs throughout the body. Seeing as sporadic ALS affects the motor neurons, which are part of the peripheral nervous system located in both the brain and spinal cord, which constitutes the central nervous system, it is clear that this disease affects both parts of the nervous system. Degeneration of the motor neurons thus results in the gradual loss of muscle because due to the fact that the motor neurons can no longer send impulses to the muscles because they're dead, muscle atrophy or the wasting of muscle tissue occurs and causes increased muscle weakness. Phenotype. ALS is characterized by progressive weakness and neuropathologically by loss of motor neurons. Typically, ALS has a mixed upper motor neuron and lower motor neuron involvement. What is the disease causing it not to work properly, and how would this work normally? The word amyotrophic comes from the Greek root that means without nourishment to muscles, and refers to the loss of signal nerves cells normally sent to the muscles. Lateral means to the side, and refers to the location of the damage in the spinal cord. Sclerosis means hardened, and refers to the hardened nature of the spinal cord in ALS. Cranial nerve nuclei are populations of neurons in the brainstem that are associated with one or more cranial nerves. The more posterior and lateral nuclei tend to be sensory, and the more anterior nuclei are motor nuclei. To generate movement, motor neurons integrate information from sensory structures and transform it into precise temporal and matutinal activation of muscles. In the spinal cord, motor neurons are organized into columns based on the location of their target muscle. Motor neurons located in the spinal cord are archetypal motor neurons that innervate muscle fibers, which creates force to move the skeleton. Transporting materials up and down the length of the motor neuron is an important cellular process that may play into damage we see in ALS. Neurons normally move cellular materials along their axons to keep nerve cells' messages flowing and to maintain the health of the whole nerve cell itself. Active transport along the extensive axons of the motor neurons convey newly made materials to the farthest reaching nerve endings and needed nutrients back to the cell body. Motor neurons may be particularly vulnerable to any genetic defect that impedes axon transport. The progressive degeneration of motor neurons in ALS eventually leads to their death. When motor neurons die, the ability of the brain to initiate and control muscle movement is lost. With voluntary muscle action progressively affected, patients in the later stages of disease may become totally paralyzed. Two types of cell death are linked to the progression of ALS. Apoptosis, also known as programmed cell death pathway, is an orderly and necessary way of cleaning old cells and maintaining balance in the body. In some cases, apoptosis can be dysregulated and that can lead to disease. Some evidence suggests that apoptosis may be a late pathway for motor neuron degeneration in ALS. Opposite of apoptosis is necrosis. It is a type of cell death that results from direct injury to the nervous system or acute infection. Necrosis produces an explosion of cell contents accompanied by inflammation and immune activation, leading to cell death. In ALS, mitochondrial malfunction. Although it is not clear exactly where in the chain of events of the ALS disease process this malfunction occurs, when mitochondria malfunction, they may fail to produce the needed energy for cells, and they may leak toxic substance called reactive oxygen species, subjecting cells to kind of poisoning known as oxidative stress, which leads to the death of the cell. Another reason muscle degeneration occurs in people with ALS is that people with ALS connect to specialized sensory neurons and receive continuous excitation from other neurons that release glutamate, an important neurotransmitter that excites motor neurons and triggers muscle movement. The motor neurons, however, do not receive synaptic connections from these specialized sensory neurons and receive less glutamate from various sources, triggering muscle movement in an unusual way. Specifically, the ALS-resistant neurons receive more discrete and specific outbursts of chemical instead of a continuous flow. Overexposure may cause an overaccumulation of calcium, which harms the cells.
So I'm going to start by explaining some symptoms of ALS, aka Lou Gehrig's. And not all people experience the same symptoms, but most of them include difficulty walking or doing normal daily activities, tripping and falling, which comes from the weakness in the legs, feet, or ankles, slurred or nasal speech, dysphagia, which is trouble chewing, muscle cramps, there's twitching in arms, the shoulders, and sometimes the tongue. The muscles are normally tight and stiff. And as mentioned, there is muscle weakness, which can affect actually the entire body, which in the arms, the legs, the neck, or the diaphragm. Sometimes there's inappropriate crying, laughing, or yawning, and just cognitive behavioral changes, and also weight loss. And this slide here just shows some of those symptoms that I mentioned. The photo on the left has excessive saliva in there, as well as dysphagia and impaired speech. And the photo on the bottom also demonstrates all those symptoms I listed out, as well as the one on the top. And then the one on the right corner just shows it broken down into the upper motor neuron and the lower motor neuron of what's affected and how. So this slide just shows a brief overview of the muscles that could be affected. And then the middle photo just shows the dysphagia. And then the photo on the right shows the different areas of the body that could have the symptom. So it demonstrates the motor neural death, and then it shows the weakness of the limbs. And from the weakness of the limbs, it goes to chronic intermittent hypoxia. So one thing connects to another is basically how the symptoms spread throughout the whole body. This slide just demonstrates the timeline of ALS, which will be mentioned later on. And then it compares ALS with multiple sclerosis and the symptoms, and it's just showing the weight loss as well. That could be one of the symptoms. So ALS often starts in the feet, limbs, or hands, and usually spreads out to the rest of the body. And some of the other muscles that are also included and affected are respiratory muscles, so like your diaphragm, your abdomen, and then swallowing muscles and speaking muscles, which I will be discussing in the next few slides. But yeah, so the first sign will occur usually in the feet or the hands, which is what this slide demonstrates. And the middle photo just shows the early weakness in the hands, highlighted in red. And then as the muscle begins to weaken more, it goes into atrophy, and then fasciculations, which is muscle twitching. So these are the muscles involved in the respiratory system. These are going to be your swallowing and speaking muscles. And when the disease advances and spreads more, the nerve cells get more destroyed in the muscles, which will get weaker. So that's why it affects chewing, speaking, breathing, and swallowing. And then in the slide here, I just have some photos of swallowing and how it occurs with ALS, as well as dysphagia, difficulty swallowing, and then as well as breathing. And in this slide, we have the diaphragm and the abdomen area as also part of the respiratory system. And it just shows a photo of how the lungs are affected, as well as the diaphragm when breathing and exhaling. And these are just some of the few voluntary muscle movements, which the neurons are responsible for having effect to ALS. And if worst case scenario, individuals won't be able to stand, walk, or use their arms if the cases are very severe. So, as mentioned before, sporadic ALS affects both the upper and lower motor neurons, but it varies with each person that has the disease. So, the upper motor neurons originate from the cerebral cortex or the brainstem, and they are located near the CNS, while the lower motor neurons transmit impulses to the effector muscles. Upper motor neuron disease causes stiffness, which is also called spasticity, and lower motor neuron disease causes the weakness, the loss of muscle, which is the atrophy, as well as muscle twitching, which are the vesiculations that I mentioned in the previous slide. And this photo just shows the upper motor neurons and the lower motor neurons and where they're located and how they affect the muscles in the body. So I'm going to be talking a little bit about muscle contraction and how it works. So the nervous system works in using neurons to send signals or messages throughout the body, and they carry messages from the brain via the spinal cord and also release a chemical reaction that is picked up by a muscle fiber, and that allows it to contract and move. And muscle contraction occurs as follows. So first, the message travels from the nervous system to the muscular system, triggering its chemical reaction. And then they contract, and then once the signal is gone, the muscle fibers relax. So in ALS, the nerve cells affected are those of control of voluntary movements like walking and talking. And this disease causes the motor neurons to deteriorate and then they die. So some types of muscle movements include extension or flexion of your knee, so your lower half of your body. So extensions of the knee would involve movement of the following muscles, which are the sartorius and the quadriceps femoris group. The flexion of the knee would involve the hamstrings and the biceps femoris, and then to a lesser extent the popliteus and the gastrocnemius. And then, as mentioned, those with ALS tend to have a symptom of muscle twitching, which are fasciculations, stiff muscles or cramps, so in turn, muscle weakness in general. And because of this, patients with ALS have weaker muscles, which makes it harder for them to perform daily routines or exercises or even walk properly most of the time. So this slide just shows the muscle contraction going on and how it works. And then this slide demonstrates the flexion and extension of the knee and the muscles involved in the ALS. So the motor neuron and the nervous system in the middle photo. And then the photo on the left just shows those if they have trouble walking. This is what's going to happen when ALS patients have that muscle weakness. So moving on to treatments, there are numerous treatments to help those control symptoms, although it will not reverse the damage done to the motor neurons. And this slide shows the medications that are often taken with patients with ALS, and they're typically prescribed to help manage the symptoms, including the stiffness, excessive saliva or phlegm, and then the muscle cramps. These don't actually cure them, but more so help reduce the symptoms. So riluzole, which is on the left side, or also known as Rilutech, it's an oral medication proven to reduce damage to motor neurons by damaging levels of glutamate. And basically, glutamate just transports messages between nerve cells and motor neurons. And this medication actually prolongs survival by a few months. And then on the right side is edaravone, also known as Radicava. And it's an IV infusion, which can slow the decline of daily functioning and works by relieving the effects of oxidative stress in relation to death of the motor neurons. So these are the two types of medications you can take to reduce the symptoms of ALS. Another form of treatment is going to be physical therapy or occupational therapy. So PT is, they use certain equipment to help enhance one's independence and safety. So it's more so recommended for the low impact aerobic exercises, which can help strengthen the unaffected muscles and range of motion. And then stretching also helps prevent painful shortening of muscles. And PT is more so recommended for exercises without overworking the muscles. And then occupational therapy helps with suggesting devices to use, so like walkers, ramps, or wheelchairs, to help remain mobile and conserve energy movement for those with a more severe case. So with speech therapy, they can help ALS individuals speak louder, more clearly, which helps them maintain the ability to communicate, shown on the left side. And then on the right side, which is actually very interesting that I found, was BCI, also known as brain-computer interference, and it allows the individual to communicate, or they control the equipment using brain activity. So this is more useful for those who have severe paralysis or impairments, and they cannot physically move or get up. So this is what they would use as another form of therapy. Nutritionists can also show how to plan and prep meals to ensure sufficient calorie intake and fiber and fluid as well, and to avoid foods that are difficult to swallow. So for those with dysphagia, this would be very helpful. And when they can no longer eat, they usually suggest a feeding tube, which is shown on the photos on the right, being inserted into the abdomen area or through the nose. And then the left side just shows good nutrition for those who would need it. And the last form of treatment would be breathing support. So there are three kinds. The first one's going to be non-invasive ventilation, which is NIV, and it can be useful for those with shortness of breath or difficulty breathing, and may only be necessary at night. And this improves the quality of life and prolongs survival for the most. So NIV is going to be the mask over the nose or the mouth. There's also mechanical ventilation, which is the two middle photos. And that's going to be your respirators, which makes your lungs inflate and deflate, which can ease your breathing problems. And then last but not least, the respiratory therapy to help ensure that individual is breathing well, and they recommend the machines if needed, and those are the photos on the right side. So the prognosis for the outlook for ALS is poor, seeing that most patients with Lou Gehrig's die from it, typically from respiratory failure. And statistics say that half of those diagnosed with ALS live about 3 years after initial diagnosis, 25% at 5 years, and then 10% for 10 years or over. So those who have inherited it caused by a genetic mutation are only likely to survive about 12 months. And this is due to the A4V impacts on the SOD1 enzyme. And since there's no cure for ALS, riluzole is the only way to extend the patient's survival by 3 to 6 months. And the photos shown on the slide shows, the right corner shows if you were to use NIV, which is the non-invasive ventilation. So for those with trouble breathing, if you were to use the masks, it shows that there is a prolonged survival. And then it shows the bottom photo, which is the prediction of the life expectancy of a patient with Lou Gehrig's and about how long they would last. And then there's a timeline on the left side that just shows the different stages of ALS and how it could affect the person as a whole.
Thank you so much for watching our presentation on sporadic amyotrophic lateral sclerosis, or ALS. Here are our references.